Thank you so much for joining us
Absolutely,
on the show
it's
again.
a pleasure.
Yeah, now I've heard that you've had a pretty big response from patients or people calling in about especially the headache segment that we talked about a couple of weeks ago. Now,
Yes.
what exactly is going on? What do people want to know?
Well, they want to know what the most common types of headaches are, and really, 45 million people in the United States suffer with some type of headache. Most common are chronic, daily, or tension type headaches.
Right.
Okay, those types of headaches are. You can have what's called episodic type headaches, and you can have the real chronic type of headaches. And the thing that discerns the two is how many days per month and that type of thing. So the chronic daily headaches are anywhere from 15 days a month on up. Now, they're the most common of all of the headaches, and like I said, 45 million people suffer from headaches. Only about 20% suffer with the migraine type headaches. But it's characterized mostly by the tight hat band type of thing, where it feels like someone's just crushing your head from side to side. They come in, they've got pain up the back of their head. It can last anywhere from 15 minutes to 30 minutes, and it can last all day long, or it can be kind of on and off all day long. And so we get a lot of patients that come in and they think that it's just a stress. They think it's all because of stress. The problem is that's not the definition of tension. Stress is a very big trigger for those types of headaches, but there's many other triggers. Diet type things can trigger those headaches. But the problem is, and what I like to tell the patients is, those are triggers, but we want to try and take the bullets out of the gun, basically.
Right.
And so that's what we try and do in our office.
Great. Now, what is it exactly that you do that can help people be relieved from these headaches?
Okay, the biggest culprit in those types of headaches is the area of the spine called the upper cervical spine, which I've got a model of it right here. This is the base of the skull. This is the top bone in the neck called the atlas.
Right.
And then the second bone is called the axis. Now, those bones are a little bit different. They're shaped a little bit different than the rest of the bones in the neck. They've got nerves that come directly straight back and go up the back of your head. Plus, they have arteries that go up through them. So if there's a misalignment in that area, it can cause pressure on the nerves and on the arteries, and it can cause these types of headaches. So what we do is we figure out what kind of misalignment this patient has. First of all, we can figure out if it's what's causing the headaches. Then we figure out what type of headache or what type of misalignment they have. And then we go ahead and we do the diagnostic type of workup, and then do the adjustments with the instrument that we use.
Right. Now, for those who are suffering or, of course, just want more information, how can we get in touch with you?
They can contact us at our website or at the phone number that I believe is on the screen right now. So we appreciate that.
Thank you so much for being here.
It's absolutely my pleasure.